AI in cardiology, transforming heart disease detection and care in India. Heart disease continues to be the leading cause of death globally, and India is no exception. Artificial intelligence, AI, is emerging as a transformative force in cardiology, enabling faster, more accurate diagnosis and tailored treatment. One of the most notable innovations in this field is the development of Circadia V, an AI tool created by a 14-year-old that detects heart disease in just 7 seconds with over 96% accuracy. This illustrates the profound potential of AI in revolutionizing healthcare delivery. Beyond individual innovations, AI systems are now being tested across large and diverse patient groups, over 15,000 in the United States and 700 in India, showing consistent accuracy and generalizability. These systems challenge traditional diagnostic practices, performing on par with expert echocardiographers in identifying heart abnormalities. This aligns with the American Heart Association's call for precision medicine tools in cardiovascular care. AI model development in India, a regional approach to a global problem. Indian researchers are tackling the country's unique cardiovascular patterns using AI. One major initiative is a collaboration between Apollo Hospitals and Microsoft's AI network for healthcare, resulting in a risk score model tailored for Indian populations. They trained the model using 7 years of clinical and laboratory data from 400,000 patients across Apollo hospitals. From this data, 60,000 patients who eventually experienced cardiac events were identified, including 34,000 whose checkup results were initially normal. The team refined their dataset using statistical methods like Spearman correlation and propensity score matching, eventually focusing on 21 key risk factors. This curated dataset was split for training and testing, ensuring robust model performance across different demographics. Model architecture, CNN-based analysis and high accuracy. Most AI heart sound analysis models rely on convolutional neural networks, CNNs, appearing in nearly 68% of research. These models typically process time-frequency features of heart sounds using inputs like MEL spectrums and log-MEL spectrums. In India, models also integrate deep learning hazards for both event prediction and time-to-event analysis. The validation accuracy of these models has been impressive. Deep learning models achieved an AUC, area under the curve, ranging from 0.84 to 0.92, significantly outperforming traditional tools like the Framingham Risk Score, 59.71%, and Q-Risk-3, 51.57%. India's AI-based cardiovascular disease risk score, AICVD, achieved an 80.15% accuracy rate and even outperformed traditional models when applied to patient data from the Netherlands. Clinical integration, AI in echocardiography and risk stratification. AI has become central to cardiovascular imaging, especially transthoracic echocardiography, TTE, a non-invasive method widely used to diagnose cardiac conditions. AI now enhances every step of the TTE workflow, from guiding image capture to interpreting results. These tools calculate ejection fractions automatically, reduce manual variability, and deliver full assessments in under 5 minutes. Deep learning models also show high accuracy in identifying heart structures, matching expert performance with correlation coefficients above 0.9. One critical diagnostic area is regional wall motion abnormalities, RWMA, essential in identifying coronary artery disease. Traditional methods show high variability between observers, with just 37% agreement. CNN-based AI models, however, achieved AUCs around 0.90, significantly improving diagnostic consistency. When comparing AI with human readers, results showed similar or better accuracy across most heart regions. Notably, AI greatly benefits less experienced clinicians. For instance, AI-assisted assessments improve diagnostic accuracy for beginners by nearly 10% across various heart regions. This suggests AI can act as a clinical equalizer, enhancing diagnosis quality in under-resourced areas. Personalized medicine, integrating genomics with AI. AI's integration with genomic data marks a major leap toward personalized cardiovascular care. Algorithms can identify complex patterns in genetic information, leading to the discovery of new biomarkers, such as microRNAs, mRNAs. These molecules appear in the bloodstream before symptoms develop and serve as early indicators of heart conditions. For example, miR-21 has been identified as a promising prognostic marker for heart failure. By combining data from electronic health records, EHRs, lifestyle, and genomic sequencing, researchers now create end-to-end AI models that provide more precise risk assessments. Some of these models, such as those using XGBoost, have achieved significantly higher accuracy, AUC 0.76, than conventional risk scores in detecting complications like bleeding risk in atrial fibrillation patients. Barriers to implementation: data privacy, bias, and regulation. Despite its promise, deploying AI in real-world cardiology practice is not without challenges. Privacy concerns are paramount since AI relies on vast amounts of sensitive patient data. India's Digital Personal Data Protection Act, 2023, aims to safeguard this data, but the black box nature of deep learning models remains a hurdle. Physicians often hesitate to trust systems whose reasoning they can't interpret. To address this, tools like Shapley additive explanations, are being developed to make AI decisions more transparent, a field known as explainable AI, XAI. However, the cardiology sector still lacks user-friendly explainability tools. Bias in AI training data is another critical issue. Digital health datasets often underrepresent rural, low-income, and minority populations. Measurement and sampling biases further reduce model fairness and accuracy. For instance, one study found that a deep learning model detected valvular heart disease in Black patients at less than half the rate of white patients. Such disparities could worsen existing healthcare inequities if not addressed. Regulatory ethics and the road ahead. India's Indian Council of Medical Research, ICMR, has introduced ethical guidelines for AI in healthcare. These include principles of informed consent, accountability, and transparency. Developers are encouraged to build ethics into their AI tools from the start. Conclusion: AI is poised to transform cardiovascular care in India. From achieving 94% accuracy in early disease detection to enhancing imaging and tailoring treatments based on genetics, AI tools are outperforming conventional methods. These systems improve speed, consistency, and accessibility, especially valuable in rural or resource-limited settings. However, the path forward includes challenges like privacy protection, transparency, and ensuring fairness across all populations. With supportive regulatory frameworks and ongoing advancements in explainability and model training, India stands at the threshold of a new era in cardiology, one where AI saves lives not just through speed and accuracy, but through equity and personalization.